Okay. So I've got 20 minutes to talk to you about migraines. It's not going to happen. I'm probably going to go over, but I'm going to try and focus on some specifics. Hold on to your hats is all I can say. So, who am I? As Alan very kindly introduced me earlier, I'm Helen Spriggs. I'm a registered nutritional therapy practitioner. I'm based in the UK. I'm also a nutrition research lecturer, and I'm a member of the Diet and Nutrition Working Group for the International Consortium. And I specialise in clinic working with hypermobile Ehlers-Danlos patients and all migraines. So I see migraine patients as well as those with EDS or HSD. I don't have any financial disclosures, but I do, as mentioned, I am a member of the consortium in a voluntary role. So a quick what we will and what we won't cover. As I say, I've got 20 minutes. So we're going to look at migraines and how they intersect with EDS and HSD, triggers, how we can track, and then some specific key nutritional considerations and also some lifestyle considerations as well. In a flare, around a flare, to try and prevent a flare, and everything that goes along that track. What I don't have the time to cover is everything migraine related. Pediatric specifics, because that's not my specialty. Medical interventions, I am not a medical doctor. I like to stay in my lane. And also every single nutrition consideration, partly because we're all individual, as Lorna highlighted earlier. And I'm also not here to talk about herbal interventions either. So, I don't have EDS, but I am a chronic, or have been, a chronic migraine sufferer. Any of these familiar for anyone? How a migraine might make you feel? I could pretty much tick all of these. I could be confused, I could be scared, I could be absolutely exhausted, I could be angry, I could be upset, I could be some kind of zombie panda thing going on the right-hand side. My husband will probably tell you yes, in the worst situations. But they're very individual, and they can change. So we have to think about how can we tailor it to you. If you experience migraines, you will be familiar with this type of sort of phase diagram that's presented in lots of different ways in the medical literature, but it walks you through the different phases typically of a migraine. Not everybody will experience all of the phases, specifically aura, and similarly not everybody will experience all of the symptoms that are listed here. I've highlighted some which you may or may not be able to see that are things that I'm looking at more specifically because they may have a nutritional impact or influence. Think about cravings, nausea, bowel changes, as Lorna was discussing, but also does a head pain worsen when we move? We're probably not going to be moving very much if that's the case. And then the associated fatigue and tiredness that can come with migraine attacks. So this is a little slide that we'll spend a bit of time on, and it's looking at where migraines intersect with EDS and HSD. And there are so many complicated, overlapping, confusing ways that we can look at this. So I'm going to try and break it down, but this is not everything. This is not how everybody's will present. Not everybody will experience symptoms that involve or presentations that involve every single system I'm going to briefly run through. First up, head. What's going on here? Have we got TMJ issues? Does that mean that we can't chew our food properly, as Lorna was mentioning, which might mean we've got altered nutritional intake, which might mean we're deficient or have insufficient levels of certain nutrients, which might contribute towards a migraine presentation. But we might also have very tight muscles, we might have dysfunction in certain joints in the head, neck, obviously cervical spine. Issues, instability can also be a factor now. We also might be thinking about postural issues. We might be thinking about a trauma-related incident around the neck that's contributing towards migraines. In our head, we have a brain. Well, maybe I do today. We'll see in about 15 minutes. But we've got to think about our neurotransmitter production, serotonin, dopamine. What's going on? So what are the messages that are being sent from our body, from our brain, apparently I don't have one, down to our body? Are we experiencing pain signals slightly differently? Is the blood supply and demand, are they being met? If we have POTS, for example, and is that having an influence on our migraine presentation? GI, this whole day is thinking about listening to our guts. They've got a lot to answer for, that's all I can say. But we need to perhaps think about ruling out celiac. Is that a consideration we need to think about? We also need to think about how our gut motility is working. So are we constipated? Are we experiencing very loose bowel movements? So we're losing lots of our nutrients. We're not even getting the chance to absorb them. And is our ability to absorb our nutrients compromised in any way? So we've got how it's working, the motility, and our elimination pathways. That also includes bladder, for example, and that starts to influence our hydration status if we're having things that are irritating our bladder, perhaps. Lungs are involved in detoxification. What are we breathing in? What are we breathing out? Are we in a highly pollinated area, in a highly polluted area? It's just raining at the moment, so we'll see most of the time. But also we can then think about our hormonal levels. Now this may be hormonal fluctuations, day to day, week to week, month to month. There may be that we're taking hormones synthetically for various reasons. We've got to think about thyroid conditions. Is that a factor that's altering our migraine presentation? And then the big question mark of genetics. Migraines, as one pool of work, there is a greater or developing understanding around certain genetic influences for migraine presentations for some people. Obviously, there is fabulous work going on around genetics for hEDS specifically. As yet, obviously, we don't have all of that, so we can't cross those two together. Maybe it's a PhD I might do, we'll see. But I think there's a lot more that we can start to look at and the bigger data pools that we have. So things like the hEDS studies, that's why it's so fantastic to get all of that data together so that the excellent researchers that are working on these things can start to get more answers. When we have more research, we can have more interventions that we can try and test. So, I hope that probably told you that migraines are quite complicated. When we layer that on top of EDS, which we also know is complicated, we definitely need more research. So what can we do right now? We can think about what's best for you and relevant for you in the here and now. Triggers, migraine triggers. These are very varied. You may experience multiple triggers that contribute to your migraines. You might only have one. We could think about the weather, changes in barometric pressure. It's been pretty stormy in the UK. We've had torrential downpours and thunderstorms, and then glorious sunshine. For me, weather is a big factor. But we can also think about chemicals, pollution, air pollution, but it also might be chemical sensitivities for personal care products, for example. Stress levels, how we're feeling. Now, stress can be physical, it can be emotional, it can be financial. There's a lot that goes into it. Our health can be pretty stressful at times as well. But also, are there times that, Lorna mentioned, something like bereavement or being angry or different situations. Understanding what your specific trigger is really important. How we move, and we might be talking about physical therapies here or doing a gentle set of movement, or it might be you have a job that's a little bit more manual. Is that a trigger? And is that layered on top of what you ate that day or what you didn't eat that day? You had to skip a meal or you ate something different. I had something completely different for my breakfast today that I wouldn't normally have. Might that be a trigger on top of lack of sleep, on top of using a different toilet, on top of number and one after the other? Hydration status is always a kind of high-level one when we're thinking about migraines, but it is essential. Timing of meals is another one we need to think about. As I said, have we skipped a meal, for example? Medications, has there been a change in medications? Has there been a need to perhaps have a review around dosage, for example, because something that you were using, say, for management, no longer is being so effective? Or have you introduced a supplement, for example, without that being signed off by a qualified professional? And then how charged is your body battery? Some of us, maybe, it's kind of always running at less than 50%, and it's one of those old phones that just depletes super quick. Just got a new phone, it's really exciting. So it stays at 70%. I am not like my phone. So we need to think about, all of these factors on top of each other. And we can start to see how some of these may interact and cross over into EDS that bit more. Ooh. There we go. A quick note on some of the research, and I appreciate some of these titles might be really small, but I just wanted to say that some of the research or some of the thought process around migraine triggers, specifically when we're thinking about diet, chocolate, caffeine, cheese, they were the previous big headlines. Actually, some of the research around this is changing, and there's a couple of papers here I've highlighted, talking about the ambiguous role of caffeine in migraine headache from trigger to treatment. That actually, was it that you had a really poor night's sleep, you've had more caffeine, and then you've ended up with a migraine attack? You've associated it to the caffeine, but was it actually traveling and a really poor night's sleep that preempted that? So it's changing, same for things like chocolate, but we can think about cheese, alcohol, salt intake, highly processed foods. There's a lot that I could go into, but I definitely can't because I'm over halfway. But there's two key quotes, I think, that are really important that I've pulled out of a couple of papers here, and I'll just read them to you. That neither a gluten-free diet in patients without celiac disease nor elimination diets have sufficient evidence for routine consideration. And that's the important thing, routine consideration, first-line approach. Removing large food groups is not the first way that we should be tackling. We need to understand those triggers more. We need to understand what's going on for you specifically. And that leads into that diet remains a crucial but underexplored component of comprehensive migraine management. Diet isn't necessarily the be-all and end-all for most people's migraines. It wasn't for me, but it's a factor. So it's just understanding that bigger picture. And what we don't have yet enough of is migraine research for specifically EDS. So what are some of the practical steps that we can take? Logging your migraine, understanding your migraine presentation is really important. There's some fabulous apps now that you can use that don't just track days with migraine, but also suspected triggers, what the weather was like, where you experienced symptoms or pain, for example. But actually, in the midst of a migraine attack, who's getting their phone out and going, yep, this is definitely what I want to do? So actually using a voice-to-text app where you don't have to be looking at it because you might be, finding that lights, bright lights, I'm under them right now, not helpful if you had a migraine. So finding a different way to record that, it might be a paper journal. There's some wonderful journals. There's even some EDS kind of illustrated ones I think that I've seen. Just a plain old diary, finding the right way for you to track. Because this will be one of the things that is asked for, first of all, and probably on a repeated occasions, once you start to engage in medical support. It will be asked early on, but also perhaps if you're changing medications or changing an intervention because you want to understand if it's being effective or not. So if you don't already have a clear understanding, a clear picture or diagnosis with a migraine or suspected migraines, then obviously GP, primary care physicians is the first port of call, who either may make an onward referral straight away or at least obtain some medical investigations first of all, and then potential diagnoses and or onward referral to specialists if required. And having the opportunity to discuss these medical strategies and support strategies is really important. The overarching theme of this conference is difficult conversations, and actually having some of those conversations, especially if you're having a migraine at that time, not ideal. So you need to try and find, are there different ways you can communicate? Having somebody with you at those appointments is important. And if you're, if nutritional support is going to be relevant for you, then making sure that it's with qualified clinicians who understand the whole picture, that holistic approach that Lorna was talking about. So we're just going to run through a few specifics when it comes to sort of hydration status and blood glucose regulation, just to kind of get you thinking. These aren't applicable for everybody. I can't give targeted advice for any specific migraine sufferers here right now, but these are some things to think about. So when it comes to hydration, we're going in and out, basically. So how much water, how much other fluids, how much smoothies. Have we got water that's going in through food, for example, nutrient-dense fruits and vegetables, soups, for example? Or what electrolytes are we getting in? Because hydration isn't just water. We've got to think about actually hydration status in the body is not just, well, I drank 2.5 litres of water today. And then we have to think about what we're getting out. So how often are we going to the toilet? What colour is our urine? Everyone's really excited to go peering down the toilet. But there's an understanding about what, toilet, have we got something that's very dark, then that's typically going to indicate there's a level of dehydration. We don't want to be overhydrated either. How much activity? What's the weather like? What's the ambient temperature like? Are we having things like alcohol that may be dehydrating us? Are we having added salt to things? Because we need to think about that from a POTS perspective. Okay, well, are we adjusting fluid intake appropriately? Blood glucose regulation. Now, this is something I see a lot of poor or dysregulated blood glucose being a factor. And then people are maybe reaching for, a nice carby snack or kind of something that's really easy to go to, sweets or chocolate, and then bang. Spike of blood glucose, crash of blood glucose, spike of blood glucose, and this kind of roller coaster carries on. So we have to think about what are our meals sort of made up of: proteins, fats, carbs. How are we getting, are the carbs releasing energy slowly for us, or are they releasing it very quickly? And also, what are we maybe getting from drinks? Are we having juices? Are we having energy drinks because we're exhausted? What's that doing to the blood glucose regulation? And the flip side, other factors away from specific dietary changes. What are our activity and movement levels? What's our sleep like? Really important quality, Lorna picked up on earlier. What are our other kind of factors? What's our blood pressure like? What other things can we measure and monitor to see if that's having an impact? And this is where things like continuous blood glucose monitors, I see that being very helpful for some people. It's not the food that's creating a spike and a dip, it's actually some of the other factors. It might be stress that's actually the thing that's tanking or elevating somebody's blood glucose, and then the actions that they take following it. Meal timings, eating on the run, we've all done it. Means we don't always make the best choices sometimes, but it was the best choice we could make right there and then. But if it's a massive factor for us, we maybe need to try and come up with some different strategies. So monitoring, finding ways, speaking to a medical professional to see if blood glucose regulation or dysregulation is something that's relevant to you and can be monitored. Having meals that are protein, fats, and carbs as a complete meal that allows a steady release of energy. And thinking about our meal timings is important. It's all well and good if you're absolutely exhausted. So we need to think about, what can we do? How can we kind of save those spoons when the battery's already empty? Or on days where it's a little bit less empty, when maybe at 50%, can we do one tiny thing, make one tiny step towards being able to prepare for tomorrow? Having your food, groceries delivered, prepping a soup that can go in the freezer that's really easy to heat up and you can just add some ready-cooked protein. Having snacks on hand that isn't just a piece of fruit or isn't just something that's carby, it also can contain proteins and fats for that complete food encounter. Batch cooking sometimes is relevant and helpful for people. Buddying up with somebody can be helpful if the tank's pretty empty. And using things like store cupboard items, freezer items is really helpful, especially when it comes to kind of fruits and veggies, having them on hand so food encounters can be nutrient dense. Running out of time, so I'm going to have to start whizzing. Nutrients as a specific, we need to think about what you're already getting in. Yes, there's specific nutrients through the research. We can see our more relevant that we need to consider. But it's important to understand where you're at now. So this may involve having some blood tests with your medical doctor. It may involve thinking about, are there medications you're taking that may be potentially depleting certain nutrients? So having a varied diet, it's a very generic statement, but colourful fruits and vegetables is a way to get a variety of different nutrients in. And thinking about nutrient deplete foods, so having something that actually has no nutritional value to it, how is that going to kind of help the body have the information? Because nutrients are the information that allow your body to go on and process the messages going from your brain to your gut, as Lorna was explaining. So specific nutrients that I would assess but not immediately supplement include B vitamins, vitamin D and E. Iron, magnesium and zinc are always considerations, but very rarely would I just jump in with, certainly with supplements on these, because it's also really important to understand that nutrients can compete for absorption. If we go all in with certain nutrients, we start to then potentially upset the balance, so we have to factor that in. CoQ10, omegas, and pre and probiotics. I definitely don't have time to talk about pre and probiotics, but we will pick that up in a chat later at some point. So supplementation, these slides I think are available, but there's some questions to ask yourself before and during if you are supplementing. Don't just take supplements long term unless it's under specific guidance. Very quickly, some practical steps to think about. If weather, heat, cold are factors, whether it's layers, hats. I'm a fan, I know we're in Ireland. I quite like my Bono glasses because light can be a trigger for me, blue light. So I put these on if I have a migraine when I'm using or watching the TV. I look like an idiot, but I don't care because it means I can still enjoy something. So just thinking about some of those practical factors if you have certain triggers that allow you to carry on and do enjoyable activities. And the very last bit, just to say about, obviously, conversations can be difficult to have if migraines are a factor for you. So, changing plans at the last minute, needing to kind of signal your way for help. Think about ways you can have some communication strategies with the different people involved, whether it's medical care, family, friends, colleagues, teachers, and support organisations. So a very brief summary, and then finally, find your nutritional zebra fingerprint was my bit of creativity. It's really important to find the thing that's relevant and specific to you. That may be with a trained professional, it's likely going to involve more than one. It should be a collaborative approach to helping you move on. Thank you very much. Sorry I ran over.